Now, our next guest, Dr. Sharad Ratna, is here with us today to share his vast experiences in obstetrics, gynecology, reproductive medicine, and sexual health. Now, he's committed to delivering the best of his medical expertise in women's healthcare, and so we're so pleased that he'll be helming a new monthly series on Vivas on all matters of women's health. Last month, we spoke about menstruation and the modern woman, and this month we move on to a condition which may cause many women to suffer in silence. But first, please welcome back to the show, Dr. Sharad Ratna.
Great to see you again.
Yes. Great to see you too, Doctor. And today we'll help more women learn about their conditions and perhaps be more comfortable and seek for treatment for it.
So, Doctor, could you please first explain to us what is polycystic ovarian syndrome?
Yeah, sure. This condition was first described by two guys, Stein and Leventhal, in 1935, where they noticed that when patients were coming to them to the outpatient clinic and they examined them at laparoscopy, they found that the ovaries were encapsulated in a very thick capsule, and they all had difficulty getting pregnant. They had problems with fertility problems. So since then, we've come to a closer understanding of what polycystic ovaries is. It's a syndrome. What I mean by a syndrome is that it's a collection of different signs and symptoms. So the presentation can be highly variable. But in this constellation of signs and symptoms includes symptoms like irregular periods or absent periods, commonly known as, in medical terms, as anovulation. Hyperandrogenism, which is basically increased male hormone testosterone, which can lead to things like acne, hirsutism and things like that. It's also associated with infertility or subfertility or difficulty conceiving, associated with obesity, insulin resistance, which is the pre-diabetic state, and the other thing is obesity.
Right.
Obesity. So these are all the things it can present with, and it varies depending on how the patient presents.
Ah, that's very interesting. Now, is polycystic ovarian syndrome a very common occurrence in Malaysia?
Yes. Okay, because it's a very difficult in coming to an exact diagnosis and coming to terms with exactly what makes up the criteria for a proper diagnosis. The prevalence varies from 16 to 30%. This is worldwide. And it can be also sometimes as high as 90% in patients with the full-blown syndrome. Because I said it's a spectrum. So from one end, which is mild, to the other end, which is very severe. So you may have a patient with, say, regular cycles with polycystic ovaries on an ultrasound scan, to the other extreme end where you have the full-blown signs and symptoms with hirsutism, where there's very high androgen levels, facial mustache and hair and beard and things like that. Hirsutism, hair growth in the hands and legs, plus obesity and difficulty conceiving.
What types of women are most prone to polycystic ovarian syndrome?
Well, I mean, the thing is, we don't exactly know what the exact mechanism is because of its variable presentation, and and it lacks clarity in terms of what exactly it is. But we do know that it may occur in, there may be a genetic predisposition in first-degree relatives. That means if your mother has it or your sister has it, you may have it. Okay. But other things that are associated with it would be if you present with the symptoms. And the other condition that's always associated with this, or most times associated with it, is obesity. Obesity, irregular cycles, and hyperandrogenism. And fertility problems.
But Doctor, you say obesity causes polycystic ovarian syndrome?
Yes.
And polycystic ovarian syndrome causes obesity?
Yeah. I think, I'm beginning to think that, you start off being very lean and thin, and this hasn't been proven or anything like that. You start off being lean and thin, and then you may have polycystic ovaries, and think as you put on weight and you become overweight and obese, that triggers your ovaries to start triggering a hormone imbalance. This causes a variety of different hormone imbalances, such as high testosterone levels, high estrogen levels, high LH levels. These are all hormones that come from the brain and the ovaries, and this leads to a chronic anovulatory state, which is chronic, a state where the eggs are not released. All right.
Now in this case, doctor, would you say that age is a factor in determining the polycystic ovarian syndrome?
Not really. Age plays a different part in reduced fertility, for example. These are two different things.
Okay.
With age, your eggs are depleted. In polycystic ovaries, let's look at the normal ovary first. In a normal ovary, you've got two ovaries. Each ovary contains follicles, which contain the eggs. And these follicles are dotted around all over the ovary. Okay? And in polycystic ovaries, the follicles are on the periphery of the ovary.
Okay.
And, and they don't reach the full size or maturity. They remain less than 10 millimeters. And as a result of that, and as a result of the possible thick capsule, which is a very simple explanation, these eggs do not mature and do not release the egg. And because you're not releasing the egg naturally, spontaneously, every month, you're not having regular cycles. So if you're releasing the eggs at erratic timings, so you're going to have irregular cycles and irregular bleeding, which occurs with irregular cycles and things like problems with fertility. Polycystic ovary.
So, Dr. Sharad, just now you mentioned that obesity can be one of the causes for polycystic ovarian syndrome. Could you go through some other causes of polycystic ovarian syndrome?
It's mainly a hormone imbalance. Okay, as I said, there's so many unknowns. But what we do know is that there's an increased level of androgens. Serum androgens, that's one pathway. Another pathway is something called insulin resistance. And insulin resistance, in an indirect way, through an interconnected pathway, affects your androgen levels again. And that also affects your estrogen levels and causes a persistently high LH level. So that is the reason you get.
And all these are hormones, Doctor?
Hormone levels,
right.
That's right.
So it's all this surge of different hormones that causes this
That's right.
syndrome.
So it's obesity, hyperandrogenism, increased insulin, and maybe a genetic predisposition.
Okay, so that was some of the causes. And after the commercial break, we'll be looking at some of the symptoms you can actually be on the lookout for after this quick commercial break.